Did you know your body has a hidden network that helps fight infections? It's called the lymphatic system, and when something goes wrong within it, one possible result is a type of cancer called lymphoma. Today, I want to explain what lymphoma is, the different types, common symptoms, how it's diagnosed, and what treatment options are available. Let's get started. First up, what exactly is the lymphatic system? Think of it as your body's drainage and defense network. It includes lymph nodes, the spleen, thymus, bone marrow, and tiny vessels carrying lymph fluid. Inside this system are white blood cells called lymphocytes, your body's infection fighters. But sometimes, these lymphocytes can grow abnormally and turn cancerous. Instead of protecting you, they multiply out of control and form tumors in lymph nodes or other organs. That's lymphoma. Now, there are two main types of lymphoma. First, Hodgkin lymphoma, less common but often highly treatable. Doctors look for a specific abnormal cell, the Reed-Sternberg cell, to make this diagnosis. Then there's non-Hodgkin lymphoma, which is more common and has many subtypes. Some grow very slowly, others can be aggressive and fast-growing. The type you have affects how the disease behaves and which treatments are best. So, what are the signs you should watch out for? The big one is painless swelling of lymph nodes, often in your neck, underarm, or groin. Other common symptoms include persistent fatigue, unexplained fevers, drenching night sweats, and unintended weight loss, especially if you lose more than 10% of your body weight in 6 months. Some people also notice itching or skin rashes. Now, I get it. These symptoms can show up with less serious conditions too, like infections. But if you're experiencing them for more than a couple of weeks, it's important to see a doctor. How do doctors figure out if it's lymphoma? Usually it starts with a lymph node biopsy. They remove tissue and examine it under a microscope. Then, you might need blood tests, PET or CT scans, and sometimes a bone marrow test to see how far things have spread. Getting an accurate diagnosis and staging is key to planning the right treatment. Let's talk treatments. Options depend on the type and stage, your age, and health. The main tools are chemotherapy, radiation therapy, immunotherapy, targeted drug therapies, and sometimes stem cell transplants. The good news? Many people respond really well to treatment, especially when lymphoma is caught early. Long-term remission, or even a cure, is possible for a lot of patients. I know a lymphoma diagnosis can feel overwhelming, but you're not alone. Thanks to medical advances, lymphoma is now one of the most treatable cancers. Early detection, an accurate diagnosis, and a personalized treatment plan can make all the difference. And don't forget about support. Leaning on your healthcare team, family, friends, and community resources really does help. If you or a loved one are facing lymphoma, talk openly with your doctors, seek out specialists, and reach out for emotional and community support. Knowledge is power. Understanding lymphoma is the first step toward taking control of your health. For more information, check out the National Cancer Institute, the American Cancer Society, or the Leukemia and Lymphoma Society. Stay informed, stay strong.